Hey there, future healthcare heroes. I'm Carl Kalima from BSN2A. For today, we're diving into a condition that sounds fancy, but is super important to understand. Gestational trophoblastic disease, or GTD. For short, it is also known as the hydatidiform mole. So what exactly is GTD? It's a rare pregnancy complication where the tissue that's supposed to develop into the placenta goes rogue. Instead of forming a healthy placenta, it becomes an abnormal cluster of fluid-filled sacs. Yep, kind of like a bunch of grapes. And sadly, there's no baby developing in most cases. Incidence and risk factors GTD affects about 1 in every 1,000 pregnancies, so it's not super common, but definitely something to be aware of. Who's more at risk? Asian women, women under 15 or over 35, and those with low animal fat intake. Who knew nutrition could be a factor, right? Okay, GTD has 2 main types, and knowing the difference is key. 1. Complete mole. This one's, well, completely mole. It's usually 46XX or 46XY, but here's the twist. It comes from sperm only. No fetal tissue at all. Partial mole. This one's like a mole-ish pregnancy. It's triploid, meaning 69 chromosomes, like 69XXY or 69XXX. For the complete mole, all the villi go cystic. Think tiny water balloons. Very high HCG levels, like sky high. And yes, it has a higher risk of turning cancerous, specifically into choriocarcinoma. While for the partial mole, some villi are normal, and there might be fetal tissue, but the fetus isn't viable. HCG levels are high, but not crazy high. And luckily, it rarely turns malignant. Diagnosis time. Now, how do we spot GTD? An ultrasound shows a snowstorm or snowflake pattern. Pretty name, serious issue. And those HCG levels? They can go over 1 to 2 million IU. Whoa. The uterus grows faster than normal. There's vaginal bleeding, either dark brown, they call it prune juice bleeding, or sometimes fresh and heavy. So what do? First up, suction curettage. This removes the abnormal tissue. Then, weekly HCG monitoring until levels drop to normal. After that, monthly checks for 3 months, just to be sure. And during this time, no getting pregnant. Why? Because we need to make sure any HCG levels aren't from a new pregnancy. If HCG levels rise again, that might signal choriocarcinoma. And that's when chemotherapy like methotrexate might be needed. Also, and this is super important, emotional support matters. Women going through GTD may feel grief or anxiety, especially about future fertility. So let's be kind, informed, and supportive. For future pregnancies, the good news? Most women go on to have healthy pregnancies in the future, but an early ultrasound is always a must just in case. That's the end of our discussion. Hope you learned something. Thanks for hanging out with me today. Don't forget to like, subscribe, and maybe snack on some grapes, just the safe kind. See you in the next lesson.